يلا اول حاجه كلنا عارفين طبعا الفيشيال artery وقتل بحثا ان الفيشيال artery arising from the anteguinal notch and in runs in tortuous course until it comes to the modulus من الانتيجونيال notch للمودولus and then it go to this area هي nasolabial. النasolabial line it's very important because it's changing the course from the bone and it become now in the soft tissue. لما بنيجي نحن النasolabial لازم change او divide the nasolabial into upper 1/3 and lower 2/3. The upper 1/3 here is very important. It's called a piriform space or pre-maxillary. All this area is a pre-maxillary space and this area is a piriform space. It has a roof, it has a floor, it has a lateral border and medial border. يعني whatever أنا لازم أكون فاهم إن nasolabial folds facial artery in lower 2/3 it become deeper to the insertions of muscles that come from the lower border of zygoma and inserted in the orbicularis oris muscle. There are three important muscles: zygomaticus minor, zygomaticus major and levator labii superioris غير طبعا levator labii superioris alicanizi muscles. All these muscles arises from the borders of the zygoma and inserted into the orbicularis oris muscle, and the facial artery runs below their insertions and it becomes superficial here. When I inject the nasolabial, I must respect this course. That's mean when I go for the lower 2/3 I must injecting subdermal or subcutaneous. ايه الفرق ما بين subdermal subcutaneous؟ subdermal هيكون angle of injections and also the amount of filler injected and type of filler is very important. When I go from down الانجل ما بين الفيلر الانجل ما بين الزاويه ما بين النيدل and the skin, and this is called angle of injection. Sometimes when it 10 to 20 like that it be superficial. When it go for 30 degree it may be also subdermal or subcutaneous. When I go 45 or 60 degree I'm now subcutaneous, and also when I go 90% degree now I'm deep on bone. أنا مسموح لي أحقن إزاي في الأرياز دي. lower 2/3 injected subdermal subcutaneous سواء بنيدل بكانيولا it's okay, linear retrograde, serial puncture or ferning technique as we all know, but the most important area and this is area أو nasolabial piriform space. When I go sometimes you go like that, okay, you directed your needle upward or lateral, you directed your needle downwards, or sometimes you go up like that exactly perpendicular, it's okay, but in the wrong place at ala groove, not at ala of the nose. طيب هنعرفها ازاي؟ هشاور لكم على صورة تانية I will mark another picture to show that we must be exactly in the alar triangle. I take a line from the ala of the nose, I take a line from the alar groove and make a triangle. I injected in this triangle. Your needle must be directed to other oral commissure like that or like that. Never ever go up, never ever go lateral علشان ما عملش hitting للfacial artery which comes sometimes sprouts and go in lateral side. I must be exactly like that or exactly like that. It's never ever your bevel directed upward or directed lateral, and this is very important. Your location also rather than the angle of injection is very important. Your location must be exactly at this area, not upward, not in the pre-maxillary area. You have to be in the piriform space, not in the pre-maxillary area. Now you are injecting the soft tissue. Yes, you are correcting the cheek, but it's very risky because you may hit the facial artery, or sometimes it's called here angular artery. And second reason, you are very close to the infraorbital artery because the infraorbital artery comes from inside, coming out from the infraorbital foramina, and it divides into 3 branches as we know and give many branches anastomosing with the facial artery. So it's very important to locate your needle and respect the angle of injection. رقم 3 must respect the amount of filler you're injecting here. Only inject about 0.3 to 0.2, never ever larger amount in the same session عشان ما تعملش indirect pressure على الfacial artery and it make ischemia لا قدر الله. So I must aspirate. رقم 4 it's good negative, not good positive, and thank you.